r/AskReddit. Doctors of Reddit, what made you say how? Are you still alive? PT3. I'm an emergency doctor, and while I had my fair share of patients lucky to be alive after serious accidents/injuries, one stands out. I was called during the night to a train vs person accident. This was a common occurrence where I was working at that time because the train line went right next to a psychiatric ward and there were a lot of suicide attempts via jumping before a train. Everyone who works in the field knows that these attempts are very often successful and there is usually not a lot for us doctors to do at the place of the incident other than to declare time of death. The head is 50 meters away from the rest of the mangled body. Yeah, he is dead alright. So, I was not really eager to arrive at the, presumably, grisly scene. But lo and behold, after arriving at the now standing freight train we hear a faint cry for help. This guy is still alive. We rush to where the sounds come from and there he is, under the train between the axles. Now, the time being nighttime, I couldn't quite see all parts of the patient, especially if all limbs were still attached to the body. I fully expected to see several severed appendages, but after I managed to pull him out with the help of my EMTs and the police, he seemed almost perfectly fine. Turns out he was drunk after a night of drinking and knew a shortcut to go home right across the train lines, where he was hit by a passing freight train going full speed. He was dragged for several hundred meters under the train and was tumbling between the axles without getting under the actual wheels. All he had to show for was a broken arm and a lot of bruises, but nothing major. After I gave him some morphine for the pain, the first thing he asked what time it is to know whether the local pub had still open for another round to calm his nerves. Drunks, man. They always seem to get lucky. Off topic though, you would think whoever made the ward would be like, maybe I should not put my psychiatric facility this close to a set of train tracks. Man, if you'd run a simulator of a guy getting hit by a full speed freight train, I'm pretty sure that getting hit exactly in the right way to survive without major life-threatening injuries will probably only happen once in a few million. Insane. My country was in a war like 25 years ago, Croatia, and my dad met a former soldier who had a big bullet wound in the center of his forehead. The story is as follows. Guy is shot, and while the bullet exits, it does leave a lot of debris in the skull. He's sent to the hospital, but because it's wartime, dudes with bullet holes in their skull are lower priority than those that have a shot at actually surviving. At that moment, a young med student surgeon asks his mentor for more practice, and the mentor is like, sure, go practice on bullet head, you can't mess him up worse anyway. This med student follows the textbook to a T, spends hours meticulously cleaning the guy's brain from bullet and bone. He moves one specific bit, the man fucking wakes up. That man is alive today. The repercussions of his wound. He can't feel his left leg from the knee down. Everything else is normal. People are surprisingly easy and surprisingly hard to kill. Isn't that just it? The tiniest little thing can kill some people, but seeing what people can live through is just crazy sometimes. Go practice on bullet head. That made me snort loudly at my desk. I like to think the guy totally owned that, or a similar nickname. Writing a case report about this guy, but here goes the short version. Guy falls drunk down a flight of stairs and wakes the next morning and goes to the ER. They do everything they should, head and neck radiographic studies, physical exam. Everything seems fine except for the laceration on his forehead. They have him lean back in the gurney and inject anesthetic so they can stitch his laceration. He starts having trouble breathing, allergic reaction, right? That's what they thought. Before long they have to intubate him, and they send him over to our trauma center, but not before mistakenly intubating, putting the breathing tube into the esophagus, not where it belongs, and, since it didn't work to keep his oxygen up, they cut the front of his neck to put a tube in there. We get him at this point, repeat the radiographs, find air in his abdomen, which suggests bowel perforation or some other trauma below the diaphragm, and head into surgery. He's in a neck brace this whole time, which is good because we get the new radiographs back and it turns out he has a broken neck. It was missed before supposedly because he has ankylosing spondylitis and it messes with x-ray images by making your spine look weird at baseline. Regardless of the broken neck though, we have to find out where that air in his belly came from. And it was a lot. We thought this guy was just fat when he came in, but it was all air. Turns out when they accidentally intubated his esophagus, they pushed so much pressure in trying to get air in that they perforated the esophagus with a bunch of little holes. Too small to stitch, so all we could do was make him NPO, nothing poros, by mouth, and feed him directly into his stomach while he was with us, and let the neurosurgeons fix his neck as best they could. When they open up the neck they find the real reason for the difficulty breathing was the huge collection of blood in front of the break was compressing his airway. Once it was out the swelling was gone, and with the plates in place on his neck all we could do was hope that he wasn't paralyzed from the broken neck and that the perforations in his esophagus hadn't infected his mediastinum, the part of the chest with a bunch of your vital structures in it, because trying to treat those with antibiotics is a beast and has a high mortality. He wakes up, not paralyzed. A few days later, not dead of infection. Lucky son of a bitch, that one. He must have gotten a hell of a settlement. So lucky that they perforated his esophagus. Yep. So somebody got fired over intubation the esophagus, right? Intubating the esophagus happens all the time. Most of the time, it is immediately recognized and corrected. The hospital I rotate at is filled with people that are so sick that there is absolutely no reason that they should be alive. We routinely see patients in the primary care office with a glucose of 400 plus and an A1C of 14. Our machine maximums out at 14. Or normal for them BPs of 180 over 110. We joke that most of the time, we couldn't kill them even if we tried. I'll share my two favorite patients here. The first is a 30-some-year-old woman that is a frequent flyer. She's at the hospital more than she's not, and had probably spent 2 full days out of the past month at home. She routinely comes in with insane blood pressures, 200 systolic, and has to get put on 4th BP medications in the ICU. She also comes in with blood sugars in the 1300s routinely. She's always crankiest during those episodes because she wants to eat, but we won't let her until we get her glucose under control. She's pretty much the only patient that I've ever seen eat McDonald's in the ICU. Most of those patients aren't even conscious enough to eat. The most amazing thing about her though is how she can function at extremely high potassium levels. She holds the record for the highest level to survive. We have a board in the residence lounge and has never gone into cardiac arrest even once, even though her last potassium that I saw was 7.6. The other patient is a middle-aged man that I truly believe has 9 lives. He has fallen off of a 3-story building, been hit by a car on the highway, and unintentionally overdosed on drugs a handful of times. In the past, he had shot himself in the head with a shotgun trying to kill himself, so whenever we would get a head caught it would light up like a Christmas tree from all the buckshot that remained in his head. He was in the ICU for a suicide attempt with 40 Percocet, 120 Prozac, a bottle of Tylenol, and a bunch of other pills that we couldn't identify. He had tried to intentionally overdose 4 times before, with very lethal drugs that would have killed most people, but survived each time. The best thing is that he woke up a few days after overdosing and pulled his breathing tube out. It took 4 nurses and 3 security guards to hold him down so we could sedate him and get the tube back in. She also comes in with blood sugars in the 1300s routinely. Jumping Jehoshaphat. Does she mainline maple sugar? I've been a dialysis nurse for the better of 25 years and the highest potassium I've ever seen, TX, and the patient survived, was 10.2. I thought for a moment I had misread it, and it was his hemoglobin. The danger, besides it being that high in the first place, was bringing down slowly. He was non-responsive at first, but woke up about an hour into the treatment, discharged himself from ICU, and walked out with a K of 6.2, still high. The human body is amazing, but that's the only double-digit K I've ever seen in a non-trauma patient. I work at a trauma center as an anesthesiologist, so I see a lot of crazy shit. People surviving stabbings, gunshot wounds to the head, a freeway collapsing on someone during construction. But one case will forever stick in my mind. I got called down to the emergency room to help manage an airway. The call said there was a woman who had a difficult airway due to trauma, and there was a splintered piece of wood in the way. I walk down, ask what the story is. Little old lady lost control of her car, ran off the road into the side of a house. She ran into a wooden porch that was positioned almost exactly at the level of her nose. So I approach the lady to see what we are working with for an airway, and she legit has a chunk of wood that has smashed her nose, is sitting right between her eyes. Thing must have been 3 inches wide, God knows how long, and about 1 inch from top to bottom. About 4 inches of board is sticking out of her face. My immediate instinct is to say holy shit. Fortunately I didn't, because it turned out the woman was conscious at that moment. I intubated her, she went off to the scanner, and then to the OR. Last I heard, after a series of reconstructive surgeries she was doing pretty well. I occasionally think back to that moment and just wonder how the hell that woman was alive. When things like this happen, are patients given anything for anxiety, or are they usually in shock? I feel like I would 100% have an anxiety attack if there was a large piece of wood in my face. Usually the pain medication will help with that. I don't know specifically how these types of emergencies are handled in the US, but in Europe you would receive anesthesia on scene if possible. If preclinical airway management is not possible, you could use drugs that don't interfere with reflexes as much, but lead to temporary memory loss. We have a young man who we see frequently in our ED/hospital. He's quite ill chronically, including an impaired immune system, end-stage renal disease on dialysis, hypertension, etc., with underlying psychiatric issues to boot. Well, not long ago he picked at his AV fistula while in a room near our and it opened up, basically painting the walls with his entire blood volume. His heart stopped. He was resuscitated with blood and his wound was closed, and he somehow lived, unaffected. He still presents frequently on the brink of death. Holy shit. I just looked up what an AV fistula is. For anyone who doesn't know, the guy had a condition in which a vein ends up connecting to an artery and balloons up, presumably from the high pressure, and starts pushing out of the skin. When the guy popped it, it was like connecting a wide hose to the guy's heart and letting it pump all of his blood out all over the room. I would imagine he bleed out pretty fast. Oh my god. I have heard awful stories about patients coming to and decathing that made me shiver, but this is a really distressing image. Edit. Why would you pick at that? Oh my god. Just like EWW, I can't stop touching my wrists and flinching, lol. Warning. The following may be disturbing, more so than the rest. 3 AM on a Saturday. I was working in the emergency room of a level 1 trauma center, and we had 3 people coming in after a gun battle. We only had 2 beds designated for severe trauma, so there was the typical discussion re which 2 people to try to stabilize, and which person to delegate to the makeshift trauma bay. Do we focus on the most severely injured, or the 2 most likely to survive? After what seemed to be a nearly comically drawn out and shakingly quiet / still wait, the first 2 victims arrived, and the stillness flipped to chaos. The first person wheeled in just didn't seem to have a head. There was this bloody mass at the top of his neck, but it didn't look human. I remember being so confused that we were using one of the bays for this person / body, who just could not still be alive. I was looking him over, and I noticed his left thumb was calmly and repeatedly cracking the knuckles on his left hand. It would squeeze one finger and rhythmically work down the other 4 and start over. He didn't have any anatomy left that we could easily intubate, and yet he was cracking his knuckles. I still can't make sense of it. He didn't stay alive much longer, maybe a couple of hours, but that knuckle cracking seemed like such a human thing to do for someone that had no reason to still be alive. My father is a firefighter / paramedic, and he has told me a similar story of a call he had to go to. It was late at night and he and the other paramedics at his station got called out to help another engine with an apparent suicide. So they roll up to the scene and apparently some kid sitting in a car on the side of the road had put a shotgun under his chin and essentially blown his head off. Blood, brains, and skull were splattered throughout the car. Kid was 100% dead. However, the weird thing was that he was still breathing, as in his chest cavity was expanding and collapsing. This freaked out the original firefighters on scene, hence calling the paramedics. And since this was early on in my dad's career, he was tasked with pulling the body out. The body continued to breathe the whole trip to the hospital. What had happened was that although the shotgun blast had obliterated the brain stem was still intact, responsible for basic functions such as breathing. The brain stem was shocked from the blast, which was why the body appeared dead at first. But as it regained consciousness, it began doing its job again until the body finally died. Eerie stuff. That's amazing and creepy. Could it have been some kind of automatic muscle memory thing? That's fucking nuts. Think it was a nervous tick of his that his body somehow resorted to doing? Like his body still had enough function left to go to something he would rely on to calm down, just off of pure muscle memory alone. I had a patient once who I use as an inspiration to others. In his late 40s he was diagnosed with alcoholic cardiomyopathy. His heart was only pumping 15% of the blood out per stroke. Normal is 60% plus. Atrial fibrillation, fast irregular heart, diabetes, and hypertension in the same day. He weighed 140 kilograms, smoked heavily, ate nothing but food from the pie shop, and spent every night in the pub. The cardiologist told him he was basically about to die, true, and was put on 5 different medications. He stopped drinking altogether, started exercising, quit smoking, ate nothing but salad. He lost 45 kilograms, his diabetes reversed, and he stopped some medications. His heart went back to 55% stroke volume, pretty much normal, and most of his HF meds were stopped. His blood pressure dropped to normal. He was the happiest he'd ever been, and not just to be alive. After a couple of false starts, he found himself a decent girlfriend. He still went to the pub for the social aspects, but drank soda water. He was a really decent bloke too, and was quite the inspiration to many people in the small country town where we were living at the time to improve their lives. Edit. Wow, that really blew up. Anyhow, I've had a few people question if diabetes is reversible. Type I diabetes is absolutely not reversible, short of getting a new pancreas. Late stage type 2 isn't either. I guess when you get to that stage you really are at a crossroads. Just a shame people have to get to that point to make a positive change. I saw a patient, 23/F, who came to the OPD with fatigue and dizziness. She was pale as a sheet and painfully thin. Her blood was drawn for testing and it looked translucent, like red wine or something. So when her hemoglobin was tested, it turned out to be 1.1. For reference, normal range is 11 to 16. Below 4 is very severe anemia. Hemoglobin less than 2 is not compatible with life. Mortality 100%. And she had the symptoms she was having for 2 years. She wasn't even in the air. She could walk short distances, talk without getting out of breath. We thought there was some technical error in the test, sent 2 different samples to different labs while blood cross-matching was going on. The results came back as 1.0 and 1.1. She got her bottles of blood, was diagnosed with 2 different types of anemia together, got treated. She went through what would have killed almost anyone, and looked much less sick than most patients with a hemoglobin of 6. I saw someone just stroll through the door of a GP's office with a hemoglobin of 3, and then refuse to go to R&D, because they felt so well. They had apparently had anemia for years, and it had gradually got worse as they were young, and it had a chronic element to it. They just physiologically adapted to it. However, I have no idea if they actually got a transfusion and survived in the end. Never stops amazing me how the human body can adapt. Guy came in about 10 minutes away from death. He had been run over by a car. By the time we prepped him, he had passed. But per the doctor's moral code, we tried to save him anyway. After hours of constant work, we gave up. We declared him dead and were packing up when he woke up. Like some horror movie type stuff. He just sat up straight and inhaled loudly. My assistant and I just looked at each other. It's been a couple of months, and he's still in NICU, but this memory will always give me goosebumps. Oh no, throw a blanket over him before he sits up, and this is my literal recurring nightmare. Thank goodness it's so early in the day. I wouldn't be able to sleep. I really feel for you. One elderly man I was taking care of in home hospice had been actively dying for 3 days. His family were there doing the usually hanging out, telling stories about dad. Very typical occurrence. The man dies. No breathing. Heart stops. Routine actions. Exactly 11 minutes. After recording no heartbeat, a full 5 minutes of listening, I'm in the kitchen making the call to notify the prosecutor's office of an attended death when, loud and clear, the man who died called out, "Is dinner ready?" I felt as though I was in a dream state. Very surreal. Walk back to his bedroom and he's bright-eyed, totally aware and talking normally, which he hadn't done in 3 weeks. The family got 2 days of dad being basically normal. He died in his sleep approx 47 hours after he died. Lol. Medically, we still don't know what happens with our brains. Apparently, in this case, this man's brain was rebooted by an internal shock. Who really knows? For me, this was the second time someone who should have died had lucid moments. Both were men and both wanted food. The first man's heart did not stop, but he wasn't lucid for 9 days. Suddenly was, sat up in bed, and asked for pancakes. I got called down to the emergency department around 2 AM to admit a patient to the ICU. The patient had been found in a car in a parking lot, unconscious and obviously having trouble breathing. The guy had a huge mass in his right neck, around the size of a grapefruit. His oxygen level was frighteningly low, so the ED docs tried to intubate him. They couldn't pass the tube due to the mass making his airway around the size of a drinking straw. After repeated attempts, they called in the surgeons on call, which consisted of a chief surgical resident and a surgical intern. Those two attempted a bedside crike, but also failed due to the neck mass. Finally, after calling in other ED docs, they managed to pass a small tube and hook the guy up to a ventilator. When I arrive, he's laying on the bed completely unresponsive. He has an ugly, gaping, but relatively shallow wound in his throat, packed with gauze from the failed crike. He has no reflexes at all. His pupils are fixed and dilated. He isn't breathing on his own, relying entirely on the ventilator. The only thing he has is a pulse. The guy's dead. His heart just doesn't know it yet. We see this all the time. The patient will hold on for a little while until someone, i.e. family, decides to pull the breathing tube, at which point they'll die. So we get him upstairs to the ICU, and I go back to sleep. I wake up a couple hours later, and hand my patients, including the guy, off to the day team. Later that afternoon I wake up again, and check up on him. Turns out he woke up around noon. He pulled out his breathing tube on his own. After coughing for a minute or two, he proceeded to loudly cuss out every person within 50 feet, asking why they didn't let him die. Turns out he's had this neck cancer for a while, and just wants to let it kill him without doing anything about it. He just wanted to peacefully suffocate and be left alone. He got out of bed, signed his against medical advice paper, and left the hospital. Never saw him again. So he fainted in a parking lot, and you guys kidnapped him and slit his throat. Course he's mad. It is amazing how often someone comes in with no reflexes and then a day or two later is being extubated. See it with postcodes and drug odds regularly. I had a patient that said she cured her AIDS. Thinking, okay, that's not really possible. I just completed her completely routine eye exam after looking for hemorrhaging or anything in the retina. Finished the exam and sort of just out of curiosity asked how she cured her AIDS. I'll never ever forget the response. Dilute 1 cup of bleach in an 8-ounce glass of water once a day. Jaw meat floor. Jesus. I've had acquaintances claim to drink a capful of bleach mixed with a gallon of water to pass drug tests, but a 50/50 mixture of bleach? Holy fuck. If you die, your AIDS goes with you, right? Unfortunately, that's a fairly common treatment for HIV among the woke crowd. Doctors won't tell you about it because they don't want to cure people, just keep selling them drugs, apparently. I'm a veterinarian. In my humble opinion, I believe that cows are capable of surviving just about anything. They're the most hardy animals on the planet. One day, I walk into the clinic and stop by a stall to see a cow, completely calm and chewing her cud. The problem? 2 legs protruding from her hind end. She had went into labor 1 month prior and was unable to deliver the calf for whatever reason. The calf had since died in the birth canal and had been rotting there since. My lucky job that day was to dismantle and pull out rotting calf pieces, brain here, leg there, liver, etc. About 3 people threw up because of the smell. Turned out that during the delivery, the calf had perforated into the mother's abdomen, and she was septic. With the removal of the calf, some heavy-duty antibiotics, and lots of care from the staff, she survived. Cows are amazing. Edit for clarification. In many bovine rearing operations, cattle are often left free to roam on tremendous amounts of property and are brought home rarely. As soon as a cow was spotted with her condition by a farmhand, she was collected and brought to us immediately for assistance. I work at a dairy farm and I've told this story before on here. Sorry I'm late. One of our girls was huge during her pregnancy. We all knew she was going to either have twins or birth a small elephant. She calved during one of the milking shifts. The calf was born dead. So we bring her into the fresh cow milking group and get her colostrum. Only thing is that she isn't letting down, so we give her a shot of oxytocin. It kind of helps, but she's looking rough. Kind of thought she had milk fever. We gave her some antibiotics after milking because it smelled like she had a retained placenta. A week later, it's the afternoon milking shift and me and the other milker are getting the next group ready for milking. We see our farm manager messing with the come along crank thing. I forget what it's called. We walk over and the smell hit first. She retained a whole calf and we didn't catch it until a week after the first birth. This calf had to be pulled out and was completely falling apart. The cow had a bumpy road after birthing, twins a week apart, but she's one of our highest producers again. She's an old lady but she's tough. I have several. One patient comes in and has been feeling some chest pain for a while. Decided to do his own stress test at the gym and couldn't last longer than a minute on the treadmill, which earned him some snarky comment from his treadmill neighbor. Turns out his left main coronary artery, aka the widowmaker, was 99% occluded. This guy could have been dead before he hit the ground if that has gone out. Then there are always those people who smoke, drink, have had cancer, heat disease, lung disease, you name it, but they somehow keep fighting. Then the people who you are amazed they live to get to the hospital, but it doesn't last very long. Like the person who had been down long enough for their cat to start to get hungry. Turns out his left main coronary artery, aka the Widowmaker, was 99% occluded. This literally just happened to my husband this past week. He went to urgent care because he was having tightness and pressure in his chest and had been for a week. Next thing we know, he's being transported to the ER with 2 stents placed. They said he'd had a minor attack in another area of the heart, but that when they did the cath, they found his LAD artery was at 99% occlusion. The cardiologist told us that, if he hadn't come in when he did, he was anywhere from days to a few weeks away from a massive likely fatal attack. It's been a real wake-up call to hear that he was that close to dying. This is my fucking nightmare. I work at a gym, and I never want to find someone dying/dead. It happens all the fucking time too. One of our nearby branches had 3 deaths in a month, one of which a guy just died sitting upright on one of the bikes. No one knew he was dead for hours. Still the craziest thing I've seen in 10 years as an anesthesiologist. We got called to a level 1 trauma, where a man had fallen out of his hang glider from a couple of 100 feet. His wife saw the whole accident happen, and he fell into a grove of trees. Screaming, she runs over to him, where multiple tree branches had broken his fall in such a way that aside from a couple of scratches on his body and face, he seemed to be okay, except for one thing. In the trauma bay, he was conscious, talking, but there was a troublesome pain in his face that turned out to be a 2-inch thick tree branch protruding out of his left eye socket. We got him intubated and took him to the CORT scanner, where it turned out that the branch was not just a couple of inches long, but 8 inches across. It had gone through his eye socket, across to the other eye, through both frontal sinuses, and stopped just short of entering the cranial cavity and injuring his brain. After a 14-hour operation involving neurosurgeons, ophthalmologists, and plastic reconstructive surgeons, the guy came out with partial vision in the eye that was injured, full vision in the other eye, and walked out of the hospital a couple weeks later. TL. Doctor, guy falls 200 feet out of the sky, lands on the ground, after having his fall broken by trees, has an 8-inch x 2-inch branch stuck through his face, and makes an almost full recovery. Oh my god. Jesus, hell of a lucky guy. I read that tree part, and was like no way. Or hell nah lol. How was the pain in his face the first thing noticed, if he had a branch stuck in his eye? What I mean to say is, how was the branch not immediately noticeable? You've reached the end. You're a star. Destroy the subscribe button for more like that.